of Representatives convenes in Washington, D.C. next week.
First District Congressman Jeff Fortenberry is spending his recess back here in Nebraska. He joins us now, and we are glad to have you here in the studio today.
Pleasure to see you again. Thank you.
Yes. Well, first of all, I think the main issue many Nebraskans are focused on right now is universal health care, and this was recently brought before the U.S. Supreme Court. What do you think the justices are going to say?
Well, I don't have to tell you this is very controversial, and it's not clear how the justices will rule. It could be 5-4 either way, but I'll tell you, when the case was being heard before the Supreme Court a couple weeks ago, I went down there to the steps. Hundreds of Americans were out there exercising their civil rights, for and against the law. Very passionate scene there. I have to tell you, I did not support this bill when it came before Congress 2 years ago. I didn't feel as though it addressed the underlying drivers of health care cost. It shifts cost to more unsustainable government spending, cuts Medicare, and erodes health care liberties. And it's that key point, whether or not this is constitutional, whether or not the government can intrude this aggressively into a health care marketplace, is the central question before the Supreme Court. So we'll have to see. I think the ruling is expected in June.
Now, if the justices do rule against it, what do you think that will mean for Nebraska?
Well, clearly then there's going to be a decision whether or not Congress needs to undertake a new law. And I support the right type of health care reform, that which is going to reduce costs and improve health care outcomes. And if you think about health care in terms of three more simple components, the first is ensuring access to affordable, catastrophic health insurance for every American. Secondly, trying to get underneath one of the most significant cost drivers, which is the onset of chronic disease through health and wellness and prevention. That's 75% of all health care costs there. And third is ensuring that the poor and vulnerable who may not fit neatly into an insurance management mechanism for their health care risk have adequate protection. If you divide the health care issue into those three components, we can come up with, I think, very good, reasonable legislation that actually creates a robust health insurance marketplace for Americans, is focused on healthier outcomes for all of us, and protects the poor and vulnerable while driving down costs. That's what I would prefer to see.
Congressman, you looks like you brought a visual aid here for us. Is this the bill? Is this the health care bill?
This is the bill.
So, yeah, looks like a lot of reading there.
At the park?
Yeah, exactly. It's pretty tough to wade through. In fact, I think one of the Supreme Court justices jokingly said, are we going to have to read this entire bill? Because it is a behemoth. It is very complicated and very controversial, as you know.
Yeah, absolutely. So again, the U.S. Supreme Court, the justices have heard the arguments on this, and you're saying we may hear something about this maybe in June.
In June, that's correct.
And no thoughts really from what you're seeing as far as which way they may go. I know at the
it is really not
the
clear.
onset they were the justices may have been a little bit maybe negative toward it, and some people were maybe forecasting they might strike down the mandate.
And then the mandate being the central part of the constitutional question, but then there are other components of the law that they may say are fine. And there's some reforms in there, such as keeping young people on health insurance until the age of 26 on their parents' insurance, that are reasonable policy reforms. But overall, I think we can do better than this piece of legislation as a country.
Okay. Well, Congressman Fortenberry, thanks for being here today. Always a pleasure, and thanks for the visual aid today.
Yeah. Okay.
Nice to see you.